Hi, this is Dr. Desmond White. So I often get consultation by people that I have not seen before. First consult, they can get me through social media, through my email. Sometimes it's just a phone call, or sometimes I bump to them in the social gathering, in a dinner, or in an exhibition, or something like that, or in a church or something like that. So I hardly give them any advice. My advice, unfortunately, when they ask me in this situation, is always the same. Come and see me in the clinic if you can. If cannot, see your own doctor. So the three reasons why I behave like that. The first is that actually we are being, as doctors, we're being monitored by three different bodies. Ministry of Health regulate doctors. Uh, the Singapore Medical Council also have an ethical code for us to follow. Number three is the medical indemnity professional insurance. I subscribe to the Medical Protection Society, MPS. Other people have different form of indemnity insurance. So there are three things that that will regulate doctor. Ministry of Health, how we run a clinic, Singapore Medical Council on our license, and our medical indemnity insurance. So three of them. So Ministry of Health as well as Singapore Medical Council actually have very strict rules. They want us to give the same care in telemedicine consultation as compared to real physical consultation. And you can imagine if I talk to you on the phone, if I email you, I can give you all the advice, I can ask you all the questions, but the one thing that I can't do it through media, through social media, through email, and that is a physical examination as well as a two-way interaction. So if you ask me a question, I can answer it by email. And you ask me another question, I can answer by email. This is obviously not as good as a physical consultation. There's also no way I can examine the patient, feel for the abdomen, look for jaundice, pallor, look for any swollen liver or spleen or ascites or lower leg edema. There's no way I can examine anybody through the internet as of now. I can feel the head and touch the abdomen and get a feel. No way, okay? So there's no way I can give the same care that I can give as a physical consult. But this is how Ministry of Health and Singapore Medical Council, SMC, regulate us. They want us to give the same level of care through a telemedical consultation as compared to a physical consultation. Our Medical Protection Society, MPS, also issue a statement and guideline to doctors saying that they will not cover for the first consult for consultation that the patient is not in Singapore. And for the simple reason, imagine someone from America have a teleconsult with me, and after that, the person want to take a legal case against me for malpractice, whatever. An MPS, which is stationed in UK, have a branch in Singapore, will not cover such indemnity case against me. So for that reason, for the first consult, for patients that are not stationed in Singapore, there's a big, huge risk that I have to take to give an advice. First, Ministry of Health and SMC will argue and say that will ask me how I can give the same level of care as compared to a physical consult in Singapore. They will ask me, can I examine the patient? Can I have a two-way consultation? Obviously not possible. On the phone, it's also not possible for me to examine you on a WhatsApp video call or on other video call. So I will be breaking SMC rules, I will breaking MOH rule if I give a first consult through teleconsult. And if there's a problem, a patient take legal action against me, my professional indemnity will also not cover. So because of SMC, because of MOH, because of MPS, I will not give any firm advice in the first consult. So if you want to consult me, sure, but my advice to you will be standard. Please come and see me if you can. If you cannot, see a local doctor. And this does not just apply to me, Dr. Desmond White. It applies to almost every doctor in Singapore. If any doctor is so brave to give you a teleconsult, give you specific treatment, specific advice, he or she run a risk that there may be a MOH audit. There may be if there's an SMC complaint, there's very little space to stand. Also, if there's a problem, a wrong advice or a questionable advice, a wrong treatment, or you have a complication following the advice and you take a legal action against the doctor, the doctor have to pay for his own defense lawyer. The insurance that been paying every year will not cover. So for that reason, I'm sorry, I cannot give you a first consult teleconsultation. Of course, along the way, some of my patients in Singapore or overseas, they have problem and they email me, Dr. Why I got side effect from this, I got problem with that. What do you do? I will give a very short advice, but the end of the advice is still the same. See me if you can. If for some reason you can't, then you see a local doctor. So it's going to this advice is going to disappoint many patients. Why can't you just tell me what to do? I'm in India, I'm in Indonesia, I can't come to Singapore. But I'm sorry, we just cannot give you any advice, any specific advice through teleconsult, especially for the first consultation without seeing you in person. This is disappointing, but this is the way we work in Singapore. This is Dr. Desmond White. Thank you.